there. Welcome back to the Garden of Epiphany, a women's health and wellness oasis. I'm your host, Raven Epiphany, and I'm so glad you decided to join us for another week. So when I started my health journey, specifically my physical health journey, one of the main questions I had was, what should I be getting from my food? Like, I had heard that food was medicine. I had heard that, food is meant to be our fuel. But as far as knowing what exactly I should be getting from food, that was a gray area for me, something that I didn't know. Yes, most of us learn in school that we need to have a well-balanced diet, and we're taught about the different food groups that we need to incorporate. But we don't often get to go into the detail about what those different food groups are actually providing us and how much we should be consuming of the, ingredients in those foods to make sure that our body is fueled and ready to go and at her best. So this week and next, we're actually going to be looking at vitamins and minerals that our body needs on a daily basis in order to be at her best. So this week we're going to be focusing on minerals. If you took chemistry back in high school or whenever, you may remember elements in the periodic table. So minerals are essentially elements that naturally occur in the earth. They are non-living and they provide different benefits to our bodies. Today we're going to look at 4 of those that we should definitely be making sure that we are getting, whether it be from our foods, supplements, or a little bit of both. So let's jump right into it. The first one we're going to be looking at today is calcium. Calcium is one of the elements, as previously mentioned. It's a mineral that helps our bodies to grow and maintain and strengthen our bones and teeth. It also helps with heart, nerve, and muscle function. So it's definitely an important one that you want to make sure that you are consuming in your diet or with supplements. So all of the measurements I'll be giving today for daily dosages will pertain to women, but I will note that if there are any males out there that are watching these videos, you need these elements or minerals too in your diet. So you may want to look up and see what dosages are recommended for men. So for calcium, women between the ages of 19 and 70 should be getting 1,000 milligrams of calcium a day. Women who are 71 and older should be getting 1,200 milligrams of calcium each day. And there is a daily limit, like a maximum that you do not want to exceed. And so for women who are between 19 and 50 years old, you do not want to consume more than 2,500 milligrams each day. And for women who are 51 and older, you do not want to exceed 2,000 milligrams per day. And so those are just the recommended daily targets, as well as the maximums that you do not want to exceed. So where does this calcium come from? Obviously, you can get supplements, and we'll talk about those in a second. But if you are looking to get as much as you can from your food, you can find calcium in dairy products. This is your milks, your yogurts, your cheeses. You can find it in dark leafy greens like broccoli and kale. You can also find it in fish with edible soft bones. And so that's like your sardines and your canned salmon. And lastly, you can get it from calcium fortified foods. So basically foods where calcium has been enriched into it. So for example, you will see cereals that have added calcium, fruit juices, and milk alternatives that have added calcium. I know personally, I like to drink almond milk, and you can definitely find almond milk that has been calcium fortified so that you are still getting your calcium each day, even if you're not drinking actual dairy milk. So considerations for taking calcium supplements. Supplements are things that you take ideally in addition to your food. And so yes, you can just take supplements and that would be, fine essentially. But the idea and the best way is to get what you need from your food and then use supplements to do just that. Supplement your diet to get you the rest of what you need. And so considerations for calcium supplements specifically is that there are 2 different forms that are recommended. I think there's more forms that exist, but there are 2 different forms that are recommended because these forms will have the highest amount of actual calcium in them, and that is calcium carbonate, which ends up having about 40% of calcium absorbed, and then calcium citrate, which ends up having 21% calcium absorbed. And so when you are trying to figure out how much calcium your body will actually absorb when you are, selecting or trying to dose out a different calcium supplement, there is a formula that I have provided that you can use to help you figure that out. You'll look at the listed dosage and you'll multiply it by the percent of the calcium by form. So let's say you are using calcium carbonate, you would multiply it by 40%. And then you will divide that product by 100. in order to give you the actual amount of calcium that you will get per serving. And that will tell you, you know, how much you need to take in order to get the recommended amount of calcium. Because again, depending on the form, you will only be getting either 40% or 21% calcium from those different products. So drug interactions to consider. If you are taking blood pressure medicines, synthetic thyroid hormones, if you are taking biphosphonates, hope I said that right, or antibiotics, or any calcium channel blockers, these are things that may have potential drug interactions, whether that means it will lower the effectiveness of the drug, if there will be adverse reactions, or if it will, you know, block the calcium from working. These are all drug interactions to be considered. So as usual, you want to check with your medical professional before adding any supplements into your normal intake process. For some calcium recommendations, if you are taking calcium carbonate, you want to take that one with food for best results. And if you're taking calcium citrate, this one can be taken with or without food. It's up to you. You can kind of use trial and error to see which one, you know, works out best for you, or whatever fits best into your daily routine. So some risk of taking calcium supplements, or, you know, calcium in dosages, is that it's not recommended for those with hypercalcemia, which means that you already have an excess amount of calcium in the bloodstream. You do not need to take any excess calcium because your body's already producing it or holding it at a higher level. You should note that excess calcium may be associated with unfavorable outcomes like heart disease. And so though it is a wonderful mineral for you, in excess it can, you know, not be so great for you. So you want to stay within those windows that were recommended previously. Some possible side effects of taking calcium supplements are you may experience gas, constipation, or bloating. And so those are things to look out for. Maybe you can counteract them with, you know, things that you're eating in your diet. And then just to note that if you have low calcium levels, you may experience, for children, they may not be able to reach their potential height fully. And for adults, you may have low bone mass, which for women specifically may lead to osteoporosis later in life. And so you want to make sure, again, that you are getting your daily target of calcium. So let's jump into our next mineral, which is iron, another very important mineral that we need to have in our diet on a regular basis. Iron helps with bodily functions like energy and focus, like gastrointestinal and immune system processing, and with our body temperature regulation. All of these are super important in making sure our body functions at her best. And I also just want to note that Black women, for whatever reason, tend to have lower levels of iron. And that has been shown over time throughout testing. So that's definitely something that if you are a Black woman, you want to keep an eye on and make sure that when you're getting your blood test, you are looking out for that. So recommended daily dosages. If you are a woman between 19 and 50 years old, you should be getting 18 milligrams of iron each day. And if you are 51 years old or older, you should be getting 8 milligrams of iron each day, with a daily limit being 45 milligrams for everyone. You should definitely not go above 45 milligrams each day. Honestly, with those low daily dosages, ideally you shouldn't even really be getting close to 45 milligrams each day, but definitely do not exceed that. And so some iron-rich foods that you can consume in order to make sure that you're getting what you need in your diet are beans, specifically white beans, and boiled or drained lentils or chickpeas are good sources of iron. Certain cooked vegetables like cooked spinach or baked potatoes also are great sources of iron. And then dark chocolate, which I know we all love our chocolate. And then roasted cashews. Cashews are actually one of my favorite healthy snacks. Honestly, it kind of quenches that sweet tooth that I have sometimes without, you know, the guilt that comes with eating cookies or cake. So also a great, you know, source of iron. And then lastly, if you are a meat eater, lean ground beef can also be a great source of iron. So some recommendations for taking iron are that the most effective option for taking iron is to take it in the morning on an empty stomach with water or fruit juice. And so that's the most ideal option for the best possible results. However, because iron can irritate your stomach, you can decide to take it immediately after your first meal of the day so that you can ideally avoid some of those stomach issues. You also want to minimize or, avoid the intake of certain foods 1 hour before and 2 hours after consuming your iron. And so you don't want to eat cheese and yogurt, eggs, milk, spinach, tea and coffee, whole grain breads, cereals, and bran. You want to avoid those 1 hour before and 2 hours after your iron consumption, ideally. And then lastly, you want to leave 1 to 2 hours between taking iron and any antacids or calcium supplements. So we talked about calcium supplements just a minute ago. You want to set your vitamin and mineral regimen such that you are not taking your calcium and iron back to back. You are leaving 1 to 2 hours in between that, and then any antacids as well. Some considerations for iron and notes for iron poisoning. People may vary in their need for iron. And so like I said, this is something that's tested when you get your blood tested. So that's something that you can check with your medical professional about before you, dive into taking iron supplements. And you definitely want to check with your medical professional before you consume high amounts of iron for more than 6 months at a time. If you have, in the moment, taking an overdose of iron, you may not see the symptoms for 60 minutes. However, you still need to act quickly. Call your doctor, the nearest poison control center, or the nearest hospital as soon as possible. And you want to go ahead and go to the emergency room and take the bottle with you. Iron poisoning is something that's possible, again, when you exceed that threshold of 45 milligrams or, exceed your personal threshold. And so if you took more iron than you were supposed to, you want to act quickly and get that resolved by a medical professional as soon as possible. So the risk of taking iron, the side effects you may experience are dark poop. You may see some green or some gray, which may be unusual before you start taking those iron supplements. You may experience constipation, upset stomach, stained teeth, a metallic taste in your mouth, and or heartburn. And so these are all things to look out for, and you can kind of counteract some of these things in your diet. If you are consuming too much iron, like I said previously, you may experience iron poisoning. So again, please take heed to the daily dosage recommendations, and especially to the daily limit of 45 milligrams each day. If you are someone who is experiencing iron deficiency, you may experience fatigue, heart palpitations, pale skin, and or breathlessness. And for pregnant women, for the mom, there may be a higher risk of infection. And for the baby, you may experience premature birth, and the baby may have impaired cognitive or behavioral development. So you want to make sure that you are getting as much iron as you need during, not just, during your everyday life, but especially during pregnancy. So our next supplement or mineral of the day is magnesium, another, key element to include in your diet. Magnesium helps to protect against heart disease, diabetes, and colon cancer. It helps with many bodily functions like energy creation, protein formation, gene maintenance, so helping with your DNA, muscle movements, nervous system regulation, and blood sugar regulation, which is obviously very important. It can also be anti-inflammatory, and studies show that it may also prevent migraines, help to improve PMS symptoms, and promote better bone health and better sleep. So magnesium is one of those magical elements that, if you are getting what you need, can do wonders for you and your body. The daily recommendation for women who are between 19 and 30 years old is 310 milligrams each day. And if you are 31 years and older, it's 320 milligrams each day. If you are pregnant at the moment, you will want to take between 350 and 360 milligrams of magnesium each day, obviously because you're growing another little human and they will be, sucking up some of that from your body. So some magnesium-rich foods that you can consume in order to get what you need are nuts and seeds like pumpkin seeds, chia seeds, almonds, and cashews, like I said, my favorite, boiled spinach, and proteins like cooked beans, cooked salmon, and peanut butter can give you magnesium. And then also brown rice is a good source of magnesium as well. Specifically for magnesium, it is very possible to get what you need from foods. And so, it's very possible that you may not need to take supplements if you are, implementing these foods into your diet on a daily basis. You should be good magnesium wise. Some considerations if you are choosing to take a magnesium supplement. So, drug interactions. If you are taking a diuretic, if you're taking heart medications or antibiotics, you may experience some drug interactions. Again, those are things that may make the other drugs less effective or, may cause some sort of side effects. And so talk to your doctor. If you are already taking magnesium supplements and they want to put you on any of these meds, or vice versa, if you're already on these meds and you would like to start taking magnesium supplements, make sure you talk to them about that. And so that you guys can work that out, either, deciding not to take the magnesium supplements, or they may be able to instruct you on a certain amount of time to leave in between each to avoid those interactions. So magnesium actually has 4 easy to absorb forms that you can choose from. And so there's magnesium citrate, magnesium chloride, magnesium lactate, and magnesium aspartate. And so when you are selecting your supplements, these are the 4 that are most highly recommended, that are most easily absorbed into your body. And I also want to note that for magnesium, each of these different forms lend themselves well to certain functions. And so I don't believe I included that here. But when you are choosing a supplement, and especially if you're choosing it for a certain reason, like for example, if you want to get better sleep, you may want to just do a little bit more research to see which of these forms would be best for the specific results that you're looking for. So, side effects you may experience while taking magnesium are nausea, abdominal cramping, and or diarrhea. And then if you are experiencing magnesium deficiency, here are some signs to look out for. You may have high blood pressure, muscle cramps and twitching. You may have osteoporosis, fatigue and muscle weakness, and irregular heartbeat. Now, these are not necessarily things that directly lend themselves to magnesium deficiency, but these are things that can come from having magnesium deficiency. And so if you're experiencing any of these symptoms, again, check with your medical professional to see if it's your magnesium levels or some other factors, so that you guys can figure out how to remedy that. As far as how and when you should take your magnesium, it can be taken at any time of the day, but whenever you choose to take it, just be consistent. In order for you to get the best results, if you choose to take it in the morning, keep taking it in the morning around the same time. If you choose to take it at night, keep taking it at night around the same time. And then also, magnesium can be taken with food to prevent upset stomach. So that's your diarrhea, your nausea, your vomiting. It can be taken with food to ideally prevent you from having these side effects. So that actually concludes our video for the day. And I'll also be including a little bit more details in the actual blog that will link to some pages where you can see exactly what amounts of each of these minerals can be found in different foods, so that you can kind of plan your diet appropriately. And I'll also link something for magnesium that gives a little bit of an outline of choosing the right form, like I mentioned earlier. So again, if you have any questions, please feel free to reach out, leave me a comment below, reach out via our website, reach out on Instagram, and I'll be happy to answer your questions or direct you to somewhere that can answer your question. If you enjoyed this video or if you learned something new, please give us a thumbs up. And if you have not subscribed to this channel, here's your personal invitation to go ahead and subscribe so that you don't miss another video, and so that you can be tuned in next week when we go over the vitamins that you need to incorporate into your diet. Thank you for watching. I am wishing you a healthy and wholesome week. Until next time, bye.